So hello everybody. I have two very special guests today. I have Dr. Kavish Chauhan. He is a renowned dermatologist and a hair transplant surgeon from India. He is also General Secretary of FU Asia and the mastermind behind FU Asia. And we have lovely Dr. Sarah. She is specialized in hair restoration from medical management to the surgical management, and she is all the way in Dubai from Kuwait. So welcome you both.
Thank you.
And you may think that hair transplant is, of course, it's very, very common, but it requires a lot of things to make it very successful and long lasting. So I'm going to ask questions to Dr. Sarah. My first question is, do you think there is a preparation that is required before a patient should consider doing hair transplant?
Preparation is critical before considering hair transplant, especially medical treatment. So we have to prepare our patient before doing hair transplant by prescribing a hair restoration medication like minoxidil. As you know, minoxidil got FDA approved since 1988 as a spray, and then it's foam. I prefer foam because it doesn't contain propyl glycol, so it's more gentle for our scalp. And also oral with optimal dose for female 2.5 and for male 5 milligram. I like to prescribe it 12 months prior to hair transplant. And also combine it, minoxidil is vasodilator. I like to combine it with anti-DHT, like finasteride or dutasteride. Finasteride got the FDA approved since 1997 as an oral medication for AGA for male with 1 milligram dose. And also we can use it as off-label for female with 5 milligram. I like to prescribe it for my patients also 12 months prior to hair transplant. Dutasteride as Avodart with 0.5 milligram is a good option. It's stronger than finasteride. If the patient consider the side effect, the mesotherapy, which is the injection of dutasteride available in all trichologist clinic, we can do that. Also PRP. PRP is one of the best treatments you can offer it for your patient before considering hair transplant. It will increase the vessel growth factor, so it will create more vessel in the scalp, so more nourish to our scalp. And also prepare our scalp before hair transplant. I like to do it monthly for 4 sessions before hair transplant. Oxosome is a new era in our ward, trichology ward. Either plant source or animal source or even autologous source is a good option to offer it to our patient. Lastly, also, I like to prescribe very nice and non-invasive treatment like LLT, low-level light therapy. Low-level light therapy is non-invasive, very simple. I always encourage my patient to get it online. And also it's FDA approved. There are many devices. I like to recommend it to my patient. They can use it like every other day for at least 18 months before consider a hair transplant.
So basically these are all like fertilizers for the skin to grow hair better and stronger and for longer.
Our goal is to increase the hair caliber. Yes. The more thickness of the hair, the more positive outcome.
Yeah, that's correct. Yeah, that's a wonderful tip. Now, many people are worried that there may be side effects of like minoxidil or finasteride. So what do you have to say about that?
Yeah, first of all, I have to reassure my patient these medications are FDA approved and from long time ago. As I mentioned, minoxidil since 1988, finasteride since 1997. So we have a history of safety to use these medications. But also I have to answer all their questions regarding if they like Google these medications online, and they like to do that. and I have to reassure them and answer all their questions. About finasteride linked to sexual side effect, we have topical form also. I have to offer it for them. Or as I said, the dutasteride mesotherapy, also a good option. So the absorption will be locally. As we know, in our sebaceous gland in the hair unit, there are DHT receptor. So the DHT, anti-DHT will target the just the scalp, not your DHT receptors in your body. So I have to make it simple as possible for them and reassure them and help them to understand their treatment process.
Yeah, that's why you need an expert like Dr. Sarah to advise you and give you the right direction to prepare your scalp for hair transplant. I mean, when you are ready for the hair transplant, we'll ask the expert, the hair transplant surgeon, let me ask you this question, what's the most advanced technique for hair transplant? Because this is what I'm sure our viewers would like to know.
Okay. So initially, so the transplant till about few decades back, FUT or the strip technique was the most common technique. In the last decade, follicular unit extraction, where we take out each single unit, that has become the most common technique. And now we are going towards an era where we can plant hair with its entire length intact and achieve the response almost immediately by planting the hair unit with its entire hair length, so that the results are almost instantaneous. This is what we call as long hair FUE. So in terms of techniques, I would say that the most recent one is this long hair FUE. And when you couple it with some advanced regenerative therapies, you can get really good results and consistently good results.
So basically there are two ways. One, either you put the seeds and wait for the plant to grow, or you bring the plant and put the plant and the plant continues to grow. This is what Dr. Kavish is specialized into. And that I believe is going to be the future of hair transplant.
Yes.
But tell me first of all, the steps that the patient needs to take to do a hair transplant from health point of view, because safety is extremely important. Everybody is worried about problems, complications. They don't want side effects. They don't want to suffer through pain.
Yes. So if you're considering a hair transplant, first of all, you need to undergo a proper pre-surgical profile. So we evaluate that from medical point of view. Are you eligible to do hair transplant? And in terms of safety wise, your blood parameters all should be perfectly safe for you to undergo hair transplant. This is one thing. Secondly, for you, when you select a hair transplant clinic, it is very important for you to see that your hair transplant surgeon preferably should be a qualified dermatologist or plastic surgeon, and it should be done in a proper operation theater setup with facilities for handling all kind of emergencies. But once you have done the investigations prior, you have checked for sensitivity, allergy testings, then overall this hair transplant is an extremely safe procedure. Many patients are worried about pain. I would say pain only happens when we are giving local anesthesia. Otherwise, during surgery, after surgery, there is almost no pain. So only when we are giving the local anesthesia, you feel the pain, which is similar to a pricking pain when you give blood sample. It's similar to that. Otherwise, during surgery, after surgery, it's relatively a painless process. So yes, so you should choose your doctor and clinic carefully and follow all the investigations. So then it is an extremely safe process.
So I have my personal experience for pain. I actually got hair transplant twice done, and I flew back to Dubai on the second day, and third day I was operating. So yes, it's very, very comfortable. And the doctors have new technique to minimize pain. Even the injections, it can be as painless as it can be.
Yes.
Now, the other important question that most of the people have is, first of all, how many hair graft you can do at one go? Because everybody wants a full head of hair in one go. Is that possible? Or how do you decide,
Okay. So in every patient, actually, this is a question between how much is the requirement and how much are the resources available in that patient. Now, in those patients who have an advanced grade of baldness, but if they have very good donor area, then it might be possible to cover the entire area. Usually, the surgery in those cases are done over multiple days. What I like to remind you is that there is also a safety limit in terms of how much anesthesia we can use in a single day. So that's why we, in general, at our clinic do not prefer to do more than 3,000 grafts in a single day. If we have to do more than that, then we plan the surgery over 2 days or 3 days. This is one thing. Secondly, in cases with advanced grade baldness, but those who have good beard and body hair, now it is possible for us to take scalp, other than scalp hairs, we can take beard grafts, chest grafts, and from other body areas too, quite efficiently, and we can utilize these grafts to cover much bigger areas. So in your case, it depends upon if the resources are available, then it is possible to cover much bigger areas. But your surgeon would be the right person to choose that how many grafts are possible in that particular patient.
I was just thinking when you talked about long hair transplant, I'm sure it's probably a huge benefit for women who wants to advance
Of
their
course.
hair
Yeah.
and they don't want to shave their head.
Hmm.
What do you have to say for that?
Oh, of course. So in females, before this long hair FUE technique, many female patients were not eager to go for opt for hair transplant because of course they don't want to trim their hairs. But now with this long hair FUE technique, they don't have to trim at all, neither in the donor area nor in the recipient area, and they can continue with their life almost without any downtime. So it's a big boon for female patients who don't want to change their lifestyle at all and who want to just continue with their daily routine while undergoing hair transplant. So it's a big boon for female cases. And with this long hair FUE technique, actually, the hair length also is immaterial. We can take out hair of almost any length and we can plant it and achieving the response instantly.
So I have one question for Dr. Sarah. After hair transplant, do you think you still need to have some medical management to make sure that the hair grows better and stays longer?
Yes, thank you for this question. Absolutely. Even post-procedure, we need to continue the medications at least for 1 year for non-scarring alopecia and 2 years for scarring alopecia. There are also special consideration like a secondary scarring alopecia, for example, burn. And it's very interesting, like the first hair transplant, maybe you agree, the first hair transplant done in Japan was for burn, for secondary scarring alopecia. But now the most common indication for hair transplant is AGA, right? So for patients with secondary scarring alopecia, usually consider fat grafting. So it will give the scalp laxity and also provide vessels, blood vessel for your next future grafting. So each cases need special preparation, either if it is a scarring or non-scarring or secondary scarring. And also for scarring alopecia, like in planopilaris and frontal fibrosing alopecia, which I consider now frontal fibrosing alopecia as epidemic disease. When at first, Dr. Cossard in 1994, when he talked about it and discovered many cases of postmenopausal women, nowadays we can see male and female, and even in 30, they have FFA and also an atypical form, and they are seeking to hair transplant. For these patients, we have to do biopsy with trichoscopy guided biopsy, a vertical, horizontal section, and also we have to follow up with the patient at least 2 years before considering hair transplant. The disease should be inactive, and then the patient should go to a good surgeon like Dr. Kavich, and he will do for him the hair transplant, and then he should follow up with me after that to see if there is also flare-up. There are many cases in the literature that some hair transplant flare disease of FFA, and also facelift can flare, any surgery can flare up FFA. So these kinds of patients, we have to be cautious with them and offer for them the best service pre and post procedure.
That's very interesting information. But you know, a lot of people come to me, and I want to ask this question to Dr. Kavish. They say, I want a hairstyle of Salman Khan. By the way, he also had hair transplant.
Yes.
Or, Tom Cruise.
Hmm.
Do you really think that you can give a hairline of a celebrity to anybody?
See, it depends upon their level of baldness. But this we do transplant for many celebrities, models, TV actors, and politicians. In many of those cases, they actually want a very high density in the hairline. In many of these cases, actually, this surgery is done in a staged manner. So in a single session itself, you can achieve a pretty good density. But if you want to go for a very high density, then sometimes we repeat the procedure in the same area and we can achieve very high density. And this, we have had many cases in which we have achieved a density even higher than what the celebrities which you mentioned have. And this is not that big a deal. It can be easily achieved. But the problem is, if you're using a lot of grafts just in the hairline area, what will happen if you get baldness in the area behind? So this also one need to consider, that we also need to consider what is going to happen in future, and we need to prepare for that also. So in most patients, we prefer to plan a conservative hair transplant. So if you're utilizing too many grafts in the hairline, it may leave you less grafts for future transplant procedures.
There is also a very interesting technique that I actually used in the past. And in fact, I'm also a model for that. It's called combo hair transplant.
Yes.
Yeah.
Where that there's not enough hair, neither in the head or in the body. Where do you get the hair from? So you can do a frontal hairline design using
Yes.
your own hair,
Yes.
and you can have a system, which is an artificial system
Yes.
to cover the rest of the head.
Yeah.
What do you have to say for that?
Also, this is a very common thing for celebrities nowadays. So
I'm
those who have advanced grade baldness and those who want to have the entire area covered, so what they do is they get their hairline designed by hair transplant, so that the hairline is looking completely natural, and they wear a hair system in the area behind, so that the entire area looks covered. So this is quite a common thing now for celebrities to get a procedure like this done. But with hair systems, you need to maintain it. It also requires some time. So if you don't want to go through that hassle, I would just recommend that you get whatever you can get with hair transplant and with medical treatment, and you be happy with it. So it's an individual choice what you want to do.
So do you agree with me that you see so many celebrities, they're all 50s and 60s with head full of hair? Do you think they all have done hair transplant?
Many of them, I believe most of them have underwent hair transplant, or they use a combo where they use hair transplant with hair systems. And also for shooting, they also use some methods to make their hairs look even more thicker. So they use hair fibers and hair spray to make the hairs look even more thicker when they are doing shooting. This is a very common thing. But for general persons, yeah, idea is not to have a very dense hairline. We just want to have a good natural looking hairline with a decent coverage. So this is what we aim with hair transplant when we're doing it for general persons. But those who specifically want a particular type of hairline, and if the donor area is available, then why not? We can do that.
I have one final but serious question. Now, as a leader of FUA Asia, and FUA Asia represents not just India, Pakistan, Bangladesh, also Middle East, and many Eastern countries, Far Eastern countries. Now, what is FU Asia doing to prevent problems in patients and to make sure that it is safe? Because unfortunately, we have heard about some incidences of hair transplant being done by non-qualified people.
Yes.
So what do you think FU Asia organization would do to protect the safety of people?
So from FUE Asia, we are creating guidelines, both from doctors' perspective, that what they should be doing before surgery, during surgery, after surgery. And also we are working on creating guidelines for the patients so that they can understand what all things they need to look for before selecting the correct hair transplant surgeon. So we are working on both of this front, and we also are working with educational campaigns to make people understand about the realities of hair transplant, what can be achieved, what cannot be achieved, who is the right candidate, who is not the right candidate. So this, we are working on this with more educational campaigns so that this information reaches to more public. But one thing which I would like to remind every one of you, two things which is very crucial for you if you want to go for a hair transplant. First, see the qualification of the hair transplant surgeon, preferably a qualified dermatologist or a plastic surgeon. Second, see the how is the clinic, and it should be done in a proper operation theater setup with all the facilities to handle any kind of emergencies.
That's wonderful. Thank you very much, Dr. Kavish and Dr. Sarah.
Thank you.
And so we pray for a lot of hair for everybody.
Thank you.
And for
Thank
their
you.
safety. And thank you very much.
Thank you. Thank you, sir.